But I guess with the significant issue of health care, that may be the dominating conversation, although I welcome conversations about other things as well. I'm away from Washington, D.C., as you know from the fact that there is the July 4th recess, and we're using this as a time to spend with Kansans, not just in town hall meetings. I think sometimes the thought is if you're not having a town hall meeting, you aren't listening, but for example, I spent 2.5 hours walking Main Street of Hiawatha, Kansas on Monday, with people who might not show up at a town hall meeting, who might not have the opportunity to get away from work and to have those conversations. And yesterday, for example, stopped at St. Francis in Topeka to figure out what's the latest in their healthcare situation and what those folks might want to tell me about this topic. I've made some indications about where I am on the current bill that was at least at one point in time pending in the United States Senate. And we had this conversation at my Lenexa town hall meeting. We kind of outlined the things that I would be paying attention to as this healthcare issue advances or is presented to Congress. And I indicated when the House bill passed the House, I'm sorry, I didn't say that quite right. When the bill was considered by the House and then withdrawn, and then the House passed a bill, in my view, that legislation was insufficient for the well-being of Kansans and Americans. And I indicated the same thing that about the bill that was being considered in the United States Senate. What I've outlined to Kansans in press and in town hall meetings is kind of 4 areas that I would be paying attention to as we decide what makes sense. First of all, I would say that there are, sometimes it's said that people who talk about this issue, it's just politics. And I would tell you that maybe there's some people who are still rehashing the presidential election in this topic, but that's not my view of what almost everyone who talks to me about healthcare is about. The conversations I have indicate to me that this is an issue that people feel very strongly about. It's very personal. And often in those conversations, a tear will start to come down a cheek as somebody tells me about somebody with a pre-existing condition, somebody with a disability, and what is healthcare changes going to mean to them. So the way I look at this is, first of all, I think there are significant problems with the Affordable Care Act. And I've indicated over a long time of these town hall meetings, for much of the last 7 years, people who have come to a meeting like this would tell me how the Affordable Care Act caused problems for them, mostly related to the cost, to the premiums, to the co-payments, and the deductibles. Sometimes about not being able to see the physician or not getting the insurance policy they wanted. But people didn't experience the benefits of many people didn't experience the benefits of lower costs that I think was hoped that would come from the Affordable Care Act. Secondly, let me do it before I go to secondly. So one of the things we would be paying attention to is what the United States Senate and ultimately that Congress might pass, if anything. Is it something that does something that not only preserves pre-existing condition coverage, but is it something that actually reduces, slows the growth of, makes more affordable premiums, co-payments, and deductibles, the cost? Then secondly, on this topic, I am a product of rural Kansas. I understand the value of a hospital in your community, of a physician in your town, of a pharmacy on Main Street. And the second aspect of this, in fact, I visited all 127 hospitals in our state, completed that 127th visit just, a month ago. And there is not a hospital that I can find in Kansas that is financially better off as a result of the Affordable Care Act. We can have a discussion if you want about expansion of Medicaid. That's a state issue, not a federal one. But the co-payments and deductibles, because they're so much larger, means that the bad debt that many of our healthcare providers have has not gone down, it's gone up. So I know the importance of healthcare in rural Kansas. A lot of what I have been about in my time in Congress is how do we make sure that rural America is alive and well. And I know in my own circumstance, if it wasn't for the hospital in my hometown, the hospital in my parents' hometown, I'll try to help you. Not everyone is arguing with the press. We try to be helpful. So, I know that in my circumstance, my sister and I would have had a conversation with my mom and dad, saying to them, "I'm sorry, Mom. I'm sorry, Dad. In the absence of our hospital, in the absence of our community physicians, you need to move." And we probably would have filled in that to where, probably with Hayes. But wherever it would have been something different than what was home for my parents. And my parents were able to live in a community that cared about them because there was a hospital, there are doctors, there was a pharmacist. All the things that were necessary for their health care existed in our hometown. And it made that conversation unnecessary, and it allowed them to remain at home. Again, with people who checked in on them, took care of them, got them to church, got them to groceries, and it would have been a different circumstance wherever else they would have lived. So the second part of this, first is the pre-existing condition and the affordability. The second part of this is, does it help or hurt keeping health care in communities across Kansas? The third part of this is Medicaid. And it's, I don't know necessarily why it's third, other than it came to me later. In a sense, it's not really anything that has to do with repeal or replace the Affordable Care Act. The only issue that I know that Medicare is involved in the Affordable Care Act is what you do with states that did or didn't expand Medicaid. But the reimbursement or the cost to the federal government or the state of Kansas associated with Medicaid is really an issue that is not directly tied to how we fix the Affordable Care Act. And I have concerns about the bill as written in the United States Senate, the bill that, I don't know what the status is of what's in writing today, but what I saw and indicated I couldn't support were things that were related to Medicaid, a couple of things that are very Kansas-oriented. First of all, it takes money out of Medicaid in Kansas to pay for states that expanded. So it takes money out of a state that didn't expand Medicaid and provides it to states that did expand Medicaid to extend the period of time that Medicaid expansion receives the higher federal reimbursement rate. And it does that at the expense of a state that didn't expand and has pretty conservative policies about who qualifies for Medicaid. So if you want to say that, I don't know how you want to describe it, if you want to say Kansas was responsible, or again, I know there'd be disagreement about that, but if you want to say that a state that hasn't spent money on Medicaid, we get punished and pay a higher price to pay for states that did it differently. So that's troublesome to me. But then just generally about Medicaid, somebody may need to get me, I feel like I'm shouting. One of the things we need to worry about, I have concern about people with disabilities, the frail and elderly. I also know that if we want health care in rural places and across Kansas, Medicaid and Medicare need to compensate for the services they provide. We all, in the absence of Medicare and Medicaid doing that, historically what's happened is that providers try to shift the cost to people who do have insurance, and so it drives up the cost for other people as well. The fourth, which is important as well, although is rarely talked about, the Affordable Care Act caused circumstances in which job growth, job creation didn't happen. People, and I can say this easily in Palco, I've told people in Washington, D.C. for as long as I've been there, that where I come from, economic development can be whether or not there's a grocery store in town. And almost no one in Washington, D.C. would understand how that could ever be an issue. This sounds like it's unrelated to healthcare, but let me describe to you being in a town in which the Chamber of Commerce and the City Council invited me to come see their new grocery store. Their grocery store was going out of business. They recruited somebody to buy it. They wanted me to see what it looked like today. And it was the thing you'd want in a small town grocery store. The deli, the fresh fruits, the vegetables, the sandwiches were made. But the owner takes me aside and says, "Senator, you need to know that there's a town down the road with the same problem this town had, and they're begging me to buy the grocery store. I've looked at the numbers, and I'm not going to do it, and I'm not going to do it because it puts me with over 50 employees, and I can't afford to have my circumstance change and have 50 employees in the Affordable Care Act come in. So my point is there are decisions that are made, that plus the 30-hour and 40-hour work week, have had significant consequences to how businesses think about what they do to put more people to work. Let me take one step back, because in my conversation about Medicaid, one of the consequences of the Medicaid changes, as we put more money into the states that expanded, one of the places it comes out of is the increase in Medicaid funding and the so-called cost of living, and whether it's a medical cost of living or something different. And they chose, in the previous bill, the cheaper version. That has huge consequences for us to be able to keep nursing home care in our communities. And again, this is a statewide issue, but in rural America, significant consequences to the ability to care for our senior citizens in the absence of adequate, appropriate Medicaid funding. Finally, to put a wrap around all this, what I wish would have happened and what I encouraged to happen unsuccessfully was, we ought to try to do this in a way in which we all have an opportunity to present our ideas and to have committee hearings, allow experts in the public to testify, and to give people a chance to get comfortable or uncomfortable with whatever the proposal is. And that's not the circumstance that we find ourselves in. It's probably not the circumstance that's going to happen in the near future. But I believe in the legislative process that allows public debate, public discussions, testimony, amendments offered by all senators. Bill comes to the Senate floor, amendments offered by all senators, and figure out where there are 60 votes to pass something that is so important to so many Americans. So, I'll say things today that, I experienced in my town hall meeting in Lenexa, in which there was slightly more people there than here, 450 or 500. Incidentally, I got booed with my first sentence, which was, I've only had one larger town hall meeting than the one we're having in Lenexa this morning. And that was when the Affordable Care Act passed, and people showed up to tell me how bad it was. And that resulted in a boo. My point is, there is a different point of view, and it affects people differently. And the end result is, we ought to be trying to take care of people who were benefited by the Affordable Care Act without doing, let me say it differently. We ought to try to take care of people who are harmed by the Affordable Care Act by also providing the kind of need and care, meeting the needs of people who were benefited by the Affordable Care Act. A difficult proposition, and my guess is very difficult, I'm going to say it differently, impossible, almost impossible, to try to solve when you're trying to do it with 51 votes in the United States Senate, in which there is not significant consensus of what the end result ought to be. That's kind of my overview of healthcare. I'm going to take this to questions or comments in just 1 second. I wanted to say something because I've said this at every town hall meeting. One of the things, and particularly related to healthcare, but benefits generally, that I pay attention to are veterans. And I want to ask you for your help and involvement. I am not a veteran. I grew up and graduated from high school in 1972. That means the Vietnam War was a significant part of my growing up life. I happened to be at an age in which the Vietnam War, Vietnamization concluded, and the United States was generally out of the war by the time I graduated. But one of the things I saw that happened in my life as a 16, 17-year-old was that our servicemen and women, as they returned, were in many instances poorly treated and not honored for their service, and didn't receive the respect and care that they earned and deserve. We're working hard to make certain that that is different today. And the reason I raise this issue for you that are veterans in the audience, or those of you who know veterans, let us help them. One of the things we've been successful at doing that I think is beneficial, certainly to the veteran and to our rural healthcare providers, is a veteran has the option now of having care at home, in the hometown hospital. Walt, we've been trying for 10 years to get the VA to contract with community mental health centers to provide mental health services to people in their homes. The Choice Act now allows veterans that option. If they'd rather have care at the Rooks County Medical Center or the Graham County Hospital, Trigo Lemke Memorial, they could do that at their choice instead of going to Wichita or Denver or Topeka or Leavenworth. And that is a huge benefit for those who live long distance. I raised this topic because the VA is implementing this bill in a way that makes it very difficult to achieve that. And there is way too much bureaucracy in getting the veteran where they need to be, and then more bureaucracy when they need another test referred by their doctor. And just, this keeps going. And we're just trying hard to get it changed. And the VA testified after this bill was passed that veterans don't want this law, don't want this option, don't like it. And so my request of you is that if you are one of those people who would qualify and want it, or if you know somebody, make sure that me or my staff know that so that we can go to bat, so that the VA can't come testify to Congress and saying this program doesn't work, nobody likes it. Because that's the direction we could be headed. And we need to demonstrate that it does work. Larry McIntyre was here a moment ago. He'd be annoyed at me for mentioning his name, but we've worked closely with him, with VVA, Vietnam Veterans of America. I shouldn't mention his name because I'm sure I'm disclosing something about his health. So there's some other veteran in Rooks County that called me to say, I need a colonoscopy. I used to tell this story, and I would say, this guy called me and said he wanted a colonoscopy, and nobody believed me. So he needed a colonoscopy. And he called and said, Jerry, I called the Wichita VA, and I told him that I needed a colonoscopy and I'd like to have it done at hometown. And he said, the VA told me, I'm sorry, sir, but you live more than 40 miles, you live less than 40 miles from Hayes, which has an outpatient clinic. Therefore, you don't qualify. And he says, oh, no, that's fine. I called the clinic in Hayes. They don't do colonoscopies. The answer was, I'm sorry, sir, you live less than 40 miles from a VA facility. And that's the kind of stuff that a veteran will throw up their hands and say, I'm done with this, and the VA will win the battle. I now chair the Appropriations Subcommittee that funds the Department of Veterans Affairs. It was my choice, but it wasn't like what I really wanted to spend my time doing. But the goal is to try to get myself in a position in which we can influence the outcome on behalf of folks who did serve, unlike me. Yes, sir.
Yesterday in the Hiawatha world, we were quoted as saying that the quote was, doesn't feel that Kansans are any better off now than they were before the ACA bill. So with that in context, and keeping things local, in 2014 here in Brooks County, where we're at, 18% of residents were uninsured. And as of December of this year, that has fallen 8%, so now just 10% of the population is uninsured. The way the mathematics work under the Senate version of the bill, there will be a premium increase for the local community here in Brooks County of over $11,000 to stay on a silver-based plan. Given the percentage of families that are living at or below the poverty line and disability, given the amount
Speak up, we can't hear you.
That the state would lose.
People who want to hear your question say.
We can't hear you either. Speak
You
up.
can't hear me either?
No.
Oh.
What are you talking to in there?
So the state stands to lose $450 million in Medicaid funding. That impacts this local community by about $60,000 for this school district. Given the loss of about 120,000 fewer people insured within the state. And we could go on. And recognizing, my view and your staff wrote the bill, nor the president really had much involvement in it. Are you able to articulate any benefit for a resident of Kansas of the current version of the Senate bill?
I have no doubt that you quoted me correctly in the Hiawatha World. What I tried to say, or was attempting to say then, is what I said this morning, which is there are people who tell me they are better off, and I believe them, and there are people who are less well off. And perhaps the difference in broad terms is those that are having an employer-based insurance program and those who are trying to be covered under an individual circumstance. And that's really what the Affordable Care Act attempts to get at, is those who are an individual, and that is a difficult, challenging market. So I would say, first of all, I'm not retracting what I said a moment ago, which is there are people who have benefited. I think that, can I name somebody that's better off? I can name people that at least tell me how their circumstance is less beneficial to them and their families, and it's the increasing cost of premiums and the insurance policies that they want. That doesn't deal with necessarily individuals and the individual market in trying to take care of them. So,
right, but setting the ACA aside, and regardless of
in this bill,
right, regardless of what a person may feel of prior president, current president, the ACA, just focusing on this bill, can you envision a scenario in which an average Kansan actually comes out better with the passage of this bill?
I think the key to having a bill that benefits an average Kansan is what, if anything, is capable of being done in regard to covering pre-existing conditions and reducing premiums, co-payments, and deductibles. That ought to be the goal of a repair, replace, whatever the words are that people use today. And that's not, in my view, where we are with the legislation pending in the Senate. The question is there something that can be done? And I await that conclusion. Bob, Doctor?
Thank you, Senator Moran, for coming with us today. I'm a pediatrician from Hayes. I actually knew your daughters before I knew you.
He's setting the stage in which I can't tell him no. As a Plainville kid, Bob, I never heard of a pediatrician. It was my Kansas City wife who told me we had to go to a pediatrician. I just thought you went to a doctor.
Some people don't think pediatricians are. Consider thinking about an issue differently. The federal government is charged with the protection of its citizens from external threat. The U.S. military provides this service and is funded appropriately. We as a culture have not accepted the responsibility to protect citizens from internal threat, disease, and injury. Health services are not funded at a military readiness level. Why do we focus on half of the citizen protection external is a core federal work and leave the other half internal to a for-profit system failing to meet some needs, a system driven by market considerations? Taxes required to fully fund healthcare needs would not exceed the cost currently paid by the citizen through individual and business insurance. Yes, taxes would be increased, but costs would not increase. Efficiency, usage, and practice might actually reduce overall expenses. What are the important needs of a country that are difficult, if not impossible, to meet by individuals or private enterprise? Certainly the military is on this list. Infrastructure needs support as well. Healthcare has not been considered a fully federal responsibility as yet. Careful review and new thinking might reveal the possibility of a need better met. We understand the impact on our country from a military attack. It is not an acceptable outcome. We are experiencing an internal attack, a broken health system, yet not funded or leading a satisfactory response. It can be addressed and resolved. Hard work and cooperation is always difficult. The reward is rich.
We thought he was a great pediatrician too. A suggestion, there is space here if folks want to come around and stand or sit in front of me. For the folks in the back, just let me respond before we go to the next question. I'll try to shorten my answer so that more people get a chance to say what they want to say. I actually thought at the time and continue to believe that we're focused on in some ways, the wrong topic when it comes to healthcare. We ought to be focused on why does healthcare cost what it does, and what can we do to reduce the unnecessary things that drive up healthcare costs before we get to the point of deciding who's paying for it. And I proposed this, Bob, a long time ago, long before President Obama was president. I hate admitting that because it demonstrates my inability to accomplish something I set out to accomplish. But there was a Moran 10-point plan that outlined things we might do that would reduce the cost of health care before we simply transfer it over to somebody else to pay for it. And it ought to be top, front and center, in my view, today, things related to medical malpractice, things related to the cost of prescriptions, more physicians. We ought to focus more attention on community health centers as we try to figure out ways to keep people out of emergency rooms who are accessing health care that way. Attention to mental health. It's an issue we haven't talked about yet this morning, but so many times in Washington when the debate turns to something's gone wrong, all of us will say we need to focus more on mental health services for more people. That's not the consequence of the bill that's in front of us today, but is worthy of our attention because wellness, fitness, diet, nutrition, prevention is the biggest bang for our healthcare savings. And we ought to be investing in the National Institute of Health to find the cure for cancer and the treatment of Alzheimer's that drive up the cost of healthcare. Yes, sir.
Jeff Zammers left. Mike's my cousin.
You're the only other person in the room that can pronounce his last name.
You should be able to.
I do. Zammers.
First of all, thank you for having this town hall. Simple observation. Universal single payer, I know gets a bad name. What about Medicare for all? For retirees such as myself, if the insurance companies, supplemental policy like we have now, let them pick up the other 20%. You pay them like they do now for a supplemental policy. Just a simple observation. I mean, it would work. We already pay into it. Why not use it? The system's already in place. And my question has to do with being a disabled vet. I am 90% service-connected disabled, and I'm paid at 100% individual and employability. Now I'm 60. Mulcahy, the current budget chief, and also the head of the VA, have been having discussions on how to bring down the cost of the VA's health care. I can't remember which one of them said it, but one of them said one of the ways was to take away individual unemployability at the age of 62. What are we who are paid at 100% supposed to do with the difference, which is substantial, between a 90% disability income to 100% disability income, when we lose that, when we still have bills to pay? As the chair of the subcommittee, I think you should have some kind of input on that. So I would appreciate you understanding that maybe people need to be better informed before they start making statements that cause instability rather than being stable. It's really hard to go out and get a loan for something that they say, well, you know, you're going to lose half your income in a year. I really can't loan you any money.